Okay, that's now live.
Thank you. I'd like to begin by welcoming those members of the public and press who are watching the live stream of this meeting via Cambridgeshire County Council's website. There's always a risk that we may run into technical problems, and if we do, we'll do our best to address them at the time. If it's not possible to address the fault, the meeting may be abandoned until such time as it can be reconvened. Can I remind members and officers that all virtual meetings are being recorded and that the recording of this meeting will be published on Cambridgeshire County Council's website. And we're going to try and do something novel today and finish on time. So can I begin by calling the names of all members of the board to establish your presence for the record? Councillor Holditch.
Present.
Councillor Fitzgerald, are you with us yet? No, maybe later. Councillor Hudson.
Present.
Dr. Liz Robin.
Present.
Wendy Oger-Welborn.
Present.
Charlotte Black.
Present.
Adrian Chapman.
Present, Chair.
Louis Camphor? Not yet. Dr. Gary Howsam? I've seen you, Gary.
Present.
Gary, you there?
Hi there.
Yeah. Councillor Bill Hanley?
Present.
And Val Moore?
Yes, present.
And myself, Councillor Hitford. We've received apologies from Jan Thomas and Ray Bisbee. Before we go on, does anyone wish to declare any disclosable pecuniary interest or non-statutory disclosable interest? If so, please raise your hand. No, not seeing anyone. Okay. Any other apologies for absence at the moment, please? We haven't got so far Louis Camphor and Councillor Fitzgerald. Is that all?
That's correct, yes.
Okay, thank you. Okay, that was agenda item 1 for apologies, etc. Agenda item 2, we're being asked to consider the notes of 2 previous meetings this time. Firstly, we're being asked to approve the notes of the meeting on 21st of December 2020 as a correct record. Can I ask if anyone who does not agree with this proposal to use the raise hand function now? Those that were present? I'm not seeing any objections to the proposal to approve the notes, so we'll take them as a correct record, and that is carried. Thank you. We're also being asked to approve the notes of the meeting on the 12th of January 2021 as a correct record. Can I again ask if anyone who does not agree with this proposal to use the raise hand function now? Again, I'm not seeing any raised hands. On that basis, I've seen objections to the proposal to approve the notes as a correct record, so we'll take that as carried. Thank you very much. Agenda item 3 is the action log. An action log has been included in the published papers for this meeting. Do officers have any further updates, please? Please raise your hand if you do. Okay, not seeing any. Does any member or any officers have questions on the action log they would like? If so, would they raise their hand, please? Okay, I did say we're going to try and get through this, so this is good news. So no members or officers have indicated that they wish to speak, so we will take the action log as noted. Agenda item 4, public questions. We've received no public questions. Agenda item 5, update on epidemiology and response. Can I invite Dr. Liz Robin, Director of Public Health, to update the board on the latest COVID-19 epidemiology and response? Liz, welcome.
Thank you, Chair. And Michelle, do you have, or Daniel, do you have the presentation? If not, I can screen share.
No, we've got it.
Can you see it? Lovely. Yes, thank you. It's not on slideshow, but we can see it. Brilliant. That's good. Okay, so I will just take you through this reasonably quickly, but identifying the key points. Firstly, this is the national picture, which is showing that after the peak of the second wave, we are seeing a fall in positive cases, patients admitted to hospital, and deaths, with an ongoing increase in testing. If you look at the map, you can see Cambridgeshire is similar to Suffolk and Northern Essex in its case rates. Peterborough more similar to Norfolk and Northamptonshire, slightly darker shading. Next slide, please. If we look at the Cambridgeshire picture, you can see that we had a sharp rise to a peak before lockdown on the 5th of January, and then a fairly steep decline again. Both charts show that that is the case, and that it was the case for both all ages and for people aged over 60 who are more likely to become seriously ill with COVID. Next slide, please. In Peterborough, what you can see is a more gradual rise to a peak around the time of lockdown, and then quite a gradual fall, which has accelerated just over the past week or so. And you can see that on both charts, and on the right-hand chart, you can see that that acceleration is both for all age cases and in the darker brown line for cases aged 60 and over. But I would emphasise that for both areas, rates are still high and very high, as you can see from the graphs from where they were at the beginning of autumn. Next slide, please. This table tells us what is happening to COVID rates in the different parts of Cambridgeshire and how we compare to the national and regional picture. And basically you can see that Peterborough, despite its fall, is still well above East of England and England averages for COVID rates. Fenland is also above average. Other districts in Cambridgeshire are below the England and East of England averages. Next slide, please. And this just shows that graphically and shows you the chart for each of the districts. So you can see Cambridge City on the top left, moving through East Cambridgeshire, Fenland, then moving down onto the bottom row, Huntingdonshire, South Cambridgeshire, and then Peterborough. And you can see that difference in pattern, with perhaps Peterborough and Fenland showing a more gradual decline in their case rates from the peak. Next slide, please. This slide presents a little information on testing. You can see that our numbers of lateral flow tests conducted in Peterborough have gone up recently. On the bottom graph, you can see that the numbers of PCR tests, which are the older tests that are conducted at the drive-through and the mobile testing units, that's gone down slightly as our lateral flow tests have gone up. The blue line shows our positivity rates, the percentage of tests which are positive, and that was flat for a long time in Peterborough, but now going down, which is good news. So although our testing rates have gone down a little bit on PCR, the percentage of tests that are positive has also gone down. Okay, next slide, please. This just shows a similar picture for Cambridgeshire, with that increase in lateral flow tests associated with a slight decrease in the PCR tests for symptomatic people, and again a rise and fall in the percentage of people who test positive out of the total number of people tested.
Liz, can I just stop you a sec? I don't know if anyone else is having this, or maybe it's just me and my display, but Michelle, you've got the next slide on the right hand side on my screen anyway. Is that for everyone? Because it just makes the actual slide we're trying to look at a little bit smaller. I just wonder if you could try and get rid of the next slide function so that we could have the actual slide we're looking at a bit bigger. I'm getting old and my eyes aren't as good as they used to be.
Hang on, I'm going to try it again.
Okay, thank you.
See what I can do.
Sorry, I'm in a meeting, mate.
That's much better.
That better?
Yes, thank you. On mine anyway. If anyone else has a problem, let me know.
Thank you.
No, carry on. Thanks, Liz.
Great, thank you. And what I would just say is that the PCR tests, the ones in the bottom graph, are for people with symptoms. The lateral flow tests in the top graph are for people without symptoms. We're seeing a fall in the people with symptoms being tested, and an increase in people without symptoms being tested, which is fine. It's good preventive work. Okay, next slide, please. So these charts are a good visual way of showing the case rates in different age group. Down at the bottom of each chart, you have your 0 to 5-year-olds. Up at the top, you've got your 90+-year-olds, and it goes up through the age groups. Moving from left to right, that is your time scale, which is right from the beginning of the pandemic. And the colour coding is that yellow is low rates of cases and black is the highest rate, purple and then black. So what you can see through that sort of colour scheme is that you can very much see the second wave at the right-hand end of the charts that we've had in Cambridgeshire and Peterborough, with purple really pretty much throughout the age ranges at the peak. What's happened in Cambridgeshire is you can see that the purple has diminished quite a lot for people of working age. So as the case rates have gone down, still quite high for the very oldest age groups. And that's also true nationally, I'm afraid, quite high rates in very elderly age groups. In Peterborough, we're seeing that the rates in the working age group are still at that purple level, still pretty high. And again, high rates in the very elderly age groups. Okay, next slide, please. So this is our hospital admissions. The blue line is North West Anglia, so that's Peterborough City and Hitchinbrook. You can see those admissions with COVID have been going up, but just recently have come down a bit. And the sort of red-brown line is our admissions to Cambridge University Hospitals Trust. Those went down a little bit earlier, in line with the earlier fall in cases in Cambridgeshire, actually. And the purple line shows all the hospitals in Cambridgeshire and Peterborough. Next slide, please. Looking at COVID-19 mortality, you can see on the right, deaths within 28 days of a positive coronavirus test in Cambridgeshire. Again, showing that sadly, that pattern where there's been a peak in cases, a peak in deaths, and then quite a rapid fall. And in Peterborough, again, mirroring the case rates and showing a more gradual rise, but still sustained at the moment. And it does take some time, sadly, for the deaths to fall after your cases have started to fall. So that's the overall picture, and obviously different scales on those two charts because Peterborough has a smaller population and therefore fewer deaths than Cambridgeshire. Next slide, please. This just looks at what we call all-cause deaths. So they're all the deaths in Cambridgeshire and all the deaths in Peterborough. And those deaths related to COVID-19 are coded in red. So you can see in the first wave back in April, there was a significant rise in mortality in both areas. When you look at the second wave, you can see more people sadly have died with a positive COVID-19 test, but actually the solid blue line is the average number of deaths at that time of year, and it's not been such a big increase in this wave as it was in the first wave. Okay, so that's the epidemiology. I'll just touch briefly on some of the response and actions. Next slide, please. And really, this is just a reminder of those key actions that we're taking. So I won't go through it in depth, although I will ask Adrian and Christine perhaps to comment afterwards. So we continue with our key responses to get control of the virus locally. Daily surveillance of cases, generic and targeted communications campaigns to support the lockdown measures, test and trace and other COVID safety measures. And as always, that is the key thing. It's the behaviour of all our residents that makes the difference to this pandemic. So that communication and engagement and each of our residents thinking about how they can keep themselves and others safe is key. Then we have several preventive and outbreak management interventions through the Cambridgeshire and Peterborough Outbreak Management Team and its cells. Strong support for clinically extremely vulnerable people and for those self-isolating through the county-wide hub and through local arrangements. And I would encourage people who want to self-isolate to get in touch with the councils because we do want to help and we can help. Then our local rapid response and support arrangements through each of our district and city councils. Each has their own goal, each does that locally tailored response. Next slide, please. Sorry, I've just got a blocker on my screen. local enhanced contact tracing to reach the cases not contacted by the National Test and Trace system. That's been very busy with the increase in cases with the second wave, and the introduction last week and this week of the community rapid testing for key workers and people who work outside the home who don't have symptoms, but we would like as many people in that position as possible to get a lateral flow test twice a week. And finally, of course, the successful rollout of the COVID-19 vaccination programme, which is key in our measures to control the virus, and the statistics in Cambridgeshire and Peterborough are currently looking very good in terms of the people being reached. So I'll leave it there. And
thanks, Liz. Michelle, can you keep these slides up there, and I'll do my best to see people as they raise their hand, etc. I've just got a couple of things, if I may, Liz. Michelle, could you go back to slide 12? Thank you. So we were talking about it not being quite so severe this time round, but surely that was basically down to the testing. We weren't testing nearly so much in the first wave, and so we weren't actually recognising COVID when it was a symptom or a factor. I mean, would that be more correct?
That's absolutely correct. So we weren't always recognising the deaths related to COVID. And this chart shows all deaths, not just the deaths related to COVID. So it shows the overall increase in deaths back in the first wave towards the left-hand side of each chart, one for Cambridge, one for Peterborough. And then it shows this winter that yes, there are more deaths where people have been identified as having had a positive COVID test. So you're absolutely right there.
Okay, thank you. And of course, the other burning question is when you mentioned that our older population is still being hit very bad by COVID-19. What sort of percentage or indication is it that our care homes are still being targeted somewhat as far as that's concerned? Targeted probably isn't the right word, but you know what I mean.
Yes, that is something that we've seen throughout the East of England region, that sadly when the community prevalence of COVID goes up, then you do inevitably see more positive cases in care homes as well. So we have seen that locally and it's been seen regionally. And that is why the residents and staff in care homes have been absolutely targeted with the priority for vaccination. Because that's all about protecting the vulnerable and making sure that our care home residents are vaccinated. So we just are watching as we progress, and we'll monitor carefully the impact of the vaccination, and very much hoping and expecting that will fall again as community rates fall, but also as those vaccinations protect people.
Very much so. Very hope so. Yes. Peter Hudson.
Yeah, thanks, Roger. Liz, just you say there's been less deaths in the second wave. I take that as because we've been through all the first wave and all the other awful bits. So there's more experience and better treatments for it. Would that be correct?
I think probably we need to be quite careful with this. I think all I was really commenting was that in the first wave, you can see quite big increases above the blue line in the overall numbers of deaths. When you look at the sort of left-hand peaks on each graph, it goes well up above that blue average line. And actually in the January peaks, the deaths go up a bit less above the average number of deaths at that time of year. We're not through it yet, so we need to see how this progresses over the next few weeks as well. I wouldn't want to make any sort of absolutely concrete statement about the overall picture over the second wave, but I think it's notable that the extra number of deaths above those that you expect on average at this time of year at this stage seems to be a bit less marked than it was in the summer. That's all.
Thank you.
Okay, thank you. I've got Adrian and then Charlotte. Adrian.
Thanks, Chair. I have a different theme, if that's okay, just to comment on the final two slides that Liz shared, which set out the response or summary of the response and key actions. I think one of the really positive features that's missing from the slides is the community resilience group which I've talked about here before, but I never shy away from paying credit to an amazing group of partners actually that have completely wrapped themselves around the public sector. And I think on our last call, we meet fortnightly. So last Tuesday, 46 different organisations were present. And their focus has been on providing immediate support to the outbreak effort, and also particularly focusing on vulnerable groups, excluded groups, those people in our society that might be more at risk from outbreaks. And I'm in no doubt that collectively they've definitely saved lives and helped our NHS stay on an even keel. And also we're now turning our attention, I know we're an outbreak board, but turning our attention through the CRG to the future and how we can support households, individuals, families out of the pandemic back into some kind of stable lifestyle, especially those people that are affected financially. So a big focus on economic hardship as a consequence of the pandemic, and also supporting people's mental health and well-being, which I know has been a theme we've talked about here before. So I just wanted to pay due credit really to that amazing group of partners, and I think without them we would probably be in a much more challenged position. Thanks, Chair.
Absolutely correct to do so, Adrian. Thank you. Charlotte.
Yes, thank you, Chair. And completely would endorse what Adrian just said. I just thought it might be helpful just to let the board know that we are now starting to see care home outbreaks slowly reduce in line with what's going on in the hospitals and in the community. And we expect probably, we're hoping that by the time we're 3 weeks after all the care home residents were vaccinated, we will see significant improvement, but we're obviously watching it very carefully.
Thank you. Thank you for that. I've got no other hands. Just one quick question from me then, Liz. With the variants, etc., do we feel that we are able to cope? I know we'll never know as much as we want to know, but you know, we don't seem to have had much of an outbreak of the South African variant, etc. If at all, I mean, tell me.
Okay, so we certainly know that it depends what you call it, the Kent variant, the England variant, that new variant that was very prominent in Kent, London and South Essex, we have seen in Cambridgeshire and Peterborough. So our measures to contain the outbreak are containing this new English variant. So that's clear. The South African variant, as you know, there are some areas where a case has been identified without an obvious link to foreign travel, and in those areas mass screening has taken place. We haven't received that message in Cambridgeshire or Peterborough at that point, but our multi-agency strategic coordinating group and tactical coordinating group, which is the different agencies across Cambridgeshire and Peterborough working together, have looked at what other areas have done when this did occur, and making sure that we have plans in place if it did occur in Cambridgeshire or Peterborough. So very much on the case with that, Councillor Hickford.
Thank you, Liz. Okay, so I've got no one else that wishes to speak. Liz, do you need anything from this board on this particular issue at the moment?
No, I think I would just say clearly that although the signs are encouraging with the fall in cases that we are seeing in Cambridgeshire and just recently in Peterborough, the rates still remain very high, and I can't emphasize that enough compared to the summer and the early autumn when we were talking about, you know, in Cambridgeshire maybe 10 cases per 100,000. In Peterborough we got worried if we had 30 cases per 100,000. We're still working at another order of magnitude with our number of cases in the community at the moment. So it's essential that we're not complacent, that we don't take our foot off the pedal, and that we continue to maintain full compliance with the lockdown rules and all the good things that have happened as a result of lockdown. I know it's very, very hard for people and very often very stressful, but it is succeeding. So if people can just keep going, that's really important.
Good. Obviously the right message to get out there. Thank you. And I know Christine and her team are working hard to get that message out as well. So thank you for that. Okay. Moving on, agenda item 6 is the vaccination delivery plan. I'd now like to invite Adrian Chapman, Service Director of Communities and Partnerships, to provide an update to the vaccination delivery plan. Adrian.
Excellent. Thank you very much, Chair. And with your permission, I'd like to also share my screen and just present a very small number of slides along with Christine, if that's okay, who's going to update us on the work that she's leading around the communications plan. So I'll just get this up now. Is that visible?
Yeah, yeah.
Great stuff. Okay, so just a very small number of slides, and really to recognise what appears now to be coming down from central government, which is a recognition of the important role that local government in particular need to play in furthering the already amazing results from the early stages of the vaccination programme. Some incredible achievements and rates in Cambridgeshire and Peterborough doing exceptionally well. The acceptance, though, I think now that we need to start to think much more broadly, more holistically as a group of partners alongside health with our local government colleagues at all tiers, as well as groups in our case, such as the Community Resilience Group that I've already mentioned, to reach absolutely everybody at the right time, however isolated or marginalised they might be, to make sure that everybody gets vaccinated. And this advice has come down in the form of a formal letter that we've received from two Secretaries of State, the Secretary of State for Health and Social Care and the Secretary of State for Communities. And I just copied two things from the letter really, which struck me as being most important. The first was the quote at the top: working in partnership to support the vaccination programme is very much the spirit of the letter, but I think is very much the spirit of the way we've operated throughout the pandemic, actually, in Cambridgeshire and Peterborough, and some exceptionally positive relationships with our health colleagues and others that stood us in good stead, actually, to match the aspirations of this letter. And then a long quote, admittedly, but nevertheless an important quote there on the screen. So the recognition that it's an ambitious programme and therefore local government needs to play a role, and that's never more important than now. Through the insight, knowledge and partnerships that we have at our fingertips, there's a recognition from the Joint Secretaries of State that we can support that programme. So I believe the letter has been shared, but there are just a couple of important features from it. And I just want to quickly set out the 7 priorities that the letter articulates in the annex. These are 7 areas, 7 themes that the Secretaries of State have recognised local government having a significant part to play in. And just quickly running through them, they fall into 2 sections. The first 4 are all the here and now priorities. These are things that we, if we haven't already, need to roll our sleeves up and get stuck into the detail on. And I'm pleased to say in Cambridgeshire and Peterborough we already are. And the second group of 3 there looks beyond the immediacy into the medium term and indeed mainstreaming the approach. So just running through the 7 priorities, the first there on capacity barriers and gaps in provision is about local government supporting our health system to make sure that everybody, wherever they live, is within close proximity to a vaccination centre. But also those people that may not be able to get to a vaccination centre are able to do so through, for example, transport, which we're already providing through our 0345 county-wide hub, or with pop-up vaccination sites or mobile vaccination units. So our knowledge of place, our knowledge of our communities, supported by our elected members, community leaders and others, to make sure that no parts of our county and Peterborough are left wanting. The second communications engagement theme is very much what Christine will update on in just a moment. And this is about starting to fight the myths and rumours that are out there that explain to people why they shouldn't get vaccinated. We want to turn it on its head and say, why wouldn't you want to get vaccinated? And Christine, I won't steal her thunder, we'll cover that off in just a second, but lots and lots of work going on to reach very vulnerable, very isolated groups, as well as our mainstream population. The third theme, rollout and operation of vaccination centres, is more about the logistics of running vaccination centres as they become more and more common and therefore more and more likely to be within communities or on the high street. the logistics of running those centres becomes more and more of a challenge. And I think local government have got a really vital role to play in practical terms around working with our voluntary sector partners on recruitment of volunteers to marshal and support vaccination operations, but also to manage the highways issues, crowd control, meeting and greeting, those non-clinical roles that will enable our health colleagues to focus on the job that they should be doing. And then the fourth immediate priority, and again, this is something we are very much ahead of the game on in our view, is identifying frontline health and social care workers. And we've been doing some really excellent work in my view. That's not too arrogant to say, I've not been leading it, so I think I'm okay to say that, with our district council colleagues and our voluntary sector colleagues to identify workers who are providing forms of social care, direct support to individuals, particularly vulnerable individuals, to make sure that they are prioritised for vaccination in line with the JCVI guidance. And that includes, for example, volunteer drivers who give up their hours, often with no recompense at all, not even expenses, to help vulnerable people get to and from hospital and to and from vaccination sites. So it's really feels the least we could do to try and prioritise that group to get vaccinated. And then further ahead, the three priorities that local government are being asked to consider, first of all, are building on the second priority in this list, which is around vaccine confidence and hesitancy, but particularly focused on life beyond the first 9 cohorts. So when we get into mass vaccination territory beyond cohort 9, which is the 50-plus-year-old group, so for the rest of the population, I think there is an expectation that that work around confidence and avoiding hesitancy is going to become more and more pressing. So that's a very long-term aspiration. There is a requirement, item 6 here, around cohorts 5 to 9, which is it includes everybody above the age of 50, and cohort 6, I think it is people aged 16 to 64 with underlying health conditions as well. So a much wider group of residents, and our role there is to support the NHS to identify those people and again make sure that they get access to vaccine swiftly and at the right time. And then action 7 is the Secretaries of State seeking our agreement to support the mainstreaming of the response. How can we bring this work into our mainstream business as usual activity alongside the work we're already doing to rebuild community confidence, get people back into work? Let's have the vaccination programme alongside all of that effort on an ongoing basis until we're told otherwise. So they're the 7 priorities. Our view absolutely is that we're in good order in Cambridgeshire and Peterborough, but we are certainly not complacent, and any challenge from the board, either today or at any point, is extremely welcome. We really want this to be right and the best we can make it for our population. Final slide from me just talks a little bit more about the community engagement effort that we're putting into this work. We've got 3 objectives really here. Obviously, building on the 7 priorities set out by the Secretaries of State, we want to maximise uptake of the vaccination. We want to make sure that groups that are seen as unequal at the moment, or perhaps marginalised or excluded, are able to understand their ability to get vaccinated. And building on that to make sure we target proactively those hard to reach groups or difficult to find groups. And we're achieving that through a range of measures that I won't go through, but are on the bottom part of this slide. And they are currently being converted into a very detailed, comprehensive and multi-agency delivery plan. I'd be really delighted to be able to share that with the board virtually between meetings, if that's acceptable, Chair, just so that you can see the scope and scale of what we're proposing, and then perhaps to invite challenge and scrutiny next time we meet on that delivery plan. But it will be very much following the theme of the 7 priorities that have previously been shared. So if okay with you, we'll move straight into Christine's update on the communications work.
Just before, if I could just make sorry, Christine, if I could just make a quick comment, because Adrian, I think it's so important what you're saying about sort of mainstreaming. And also, you know, the fact is that the rhetoric that's coming out now is that this, you know, could possibly not just be the 1/2 jabs this year, but this could be ongoing. And so it makes absolute sense that, you know, government neither could or should be continuing this. It's got to be done at a more local level, especially if it becomes an annual or even more frequent occurrence. So I think it's a really interesting bit of information, and those slides and where we are in it all. So
thank you, Chair. Thank you. I mean, I absolutely agree. We know our place best of all, don't we? And we know what makes communities tick, what's going to motivate communities. Sadly, we are learning every day of some of the myths and rumours that are still resonating across some of our communities in Cambridgeshire and Peterborough, and it's heartbreaking to hear. But we are best placed to break through those rather than a top-down national approach. So I fully agree, of course.
So, Christine, if you could just bear with me, I've got Val that wants to come in. I assume it's what on Adrian's just said as well, Val, is that right?
Yeah, is that okay? It was on the looking further ahead piece about the groups, the priority groups still to be vaccinated, and particularly as a partnership between local authorities and with health and others as well. As carers come on board for vaccinations, which they're invited to in cohort 6, are we confident as a partnership that the carers know how to identify themselves and to whom? And I think the answer is that it's to GPs, and a GP is fully aware of how to respond so that they get a swift invitation for vaccination, because they need to go on a carers register in GP practice, I think, to get that swift follow through. And I mean, the reason why this is possibly going to be a bit of a unsmooth journey is carers weren't identified initially on the JCVI priorities, but came in, I think, around the end of December, beginning of January. And like most of us, you read a document when it first comes out, you don't go back to it, do you, when it's had a little tweak or an update. And the definition of carers is not simple. It's, okay, you could receive a carer's allowance, or you could come under the general definition of caring for someone whose health and welfare is at risk. Which is quite broad. So we're ready for this. And then you've got paid carers. Okay, if they're paid by an agency, then you imagine they'll get organised and smoothed through the system. But if they're paid, if they're self-employed carers or working through direct payment from the local authority, you know, how are we preparing those lists or encouraging people to get on the GP's list if that's how it'll be negotiated through in the end, because as soon as we can open up the vaccinations to the next group, then my understanding is carers are in that group 6, to have it go smoothly rather than in a very sort of crunchy and uneven fashion makes a lot of sense if we can put that preparation in.
Thanks, Val. Charlotte, I saw you coming in. Would that be on the back of this?
Yes, it would, Chair. So I completely agree with Val's concerns. I think we do need to do some work so we've got a really clear plan around carers. There have been some discussions, and I'm aware that some of the mass vac centres and some of the individual GPs are being very pragmatic. So if a carer comes in with their cared for person, they will often do both, but that's really exercising the clause within the guidance around clinical judgment. So I think we do need a more concrete plan, and it is something that's very much on my agenda to be discussing with the CCG, Val, but it might be worth contacting. I don't know if there's anyone CCG who can answer that today, but it might be worth a direct conversation as well from Health Watch, because it's potentially quite complicated, but actually it's something the local authority can really help with.
Yeah, Gary, is that something you can take away?
Yeah, I was just going to comment on that, if I may, because I think it's absolutely vital that we identify carers through GP practices, and not just around this programme. It's something that's obviously very important, and then we find a lot of people don't self-identify as carers. So it's something that is very much on the agenda in general practice. It's a very easy mechanism that people can register, and then it becomes coded in their record. So it's easy for us to identify that cohort. I think once there's more information comes down from the national team as to whether the cohorts will be nuanced further, then we'll be able to do a very targeted piece of work around that. But it's most definitely on the radar, and I know it's something that local authority and health colleagues along with Health Watch have been talking about previously, and it's something that we will aim to achieve And just a message to the public watching this is also the importance of being registered with a GP. And there's information going out in a number of different languages that the national team have been coordinating, because it is, again, for a whole host of reasons, but especially around access to COVID vaccinations, important that people are registered with a general practice. Thank you,
Thanks,
Chair.
Gary. Yes, thank you everyone on that. Okay, so Christine, thank you for your patience. Moving on, you've got hopefully almost 20 minutes now on your important issue.
Hopefully I won't take anything like that, so you've got lots of time to ask questions. So on the slide before, I took the piece directly from the letter, so it talks very much about developing a locally appropriate tailored communication plan around fostering confidence around take-up. So and to my mind, that is handing over to the local area and to the local SCG, the local LRF communications cell, responsibility for looking at what the local situation is and tailoring a communications plan around that. And I think there has been some frustration about some of the stranglehold, and I think for very, very good reasons, that nationally we've had a lot of materials that have come down. There's been a lot of national control around messaging, but we know from the work that Adrian has done with our community groups that the national messaging doesn't always resonate. It's too far away from a lot of people. They don't see local people talking about these issues. They don't see it in the languages that they understand, and not just the different languages, not just in French or Spanish or English. It's just the words that are used are not the words that resonate with lots of people in our local area. So I'm seeing, and I'd be really happy at the end of this to get your thoughts on how you want this to be developed. But I'm seeing this as a green light to do something more local and more tailored to our community, as it says in the letter to us. So on the next slide, just to say that it is a priority, that we have already started working up a very draft plan in development throughout the whole Warden Informed Communications Cell. We started a small task and finish group with our CCG colleagues, with PHE England, and we are testing out some of the things that we think will work based on the things that we know. So currently we've got some stuff out for discussion, but I'm not bringing it here for you today because it's still very much in discussion stage. But it also brings together all of the information that we are now gathering about what we've done in the past that has worked, and what our community engagement specialists are telling us are the most common things which are getting in the way of people taking up vaccinations or being concerned about it. And this could be geographical, this could be concerns that people have about a whole range of things, or it may be about misinformation, it may be about a community that have been less engaged with health, or are more suspicious or more concerned about health. It may be that they've got particular health issues that they're concerned about. So we are trying to filter all of those things through and come up with something very much which, whilst still sticking to, we don't want to start making up our own public health advice or our own things like we want to use absolutely the best advice from Liz and all the public health teams, from Gary and the clinical clinicians about this, but we want to use the language that people use, we want to use the terms, we want to find out why people are concerned, and we want to reassure them and give them opportunities to discuss with people like them. So I'm very much looking for your guidance and direction about how far you would like us to go on this. So far, we are looking at two approaches. We are looking at a very general approach aimed at the general population to build trust and take up, because this is what we don't want to do is just filter down to groups who traditionally haven't had big take up of vaccine programs, because there's never been a vaccine program like this. There's never been a vaccine program which has gone for which is aimed at everybody. So we don't have enough data to say exactly who might be the people who are most hesitant or most unconcerned about this. So whilst we have some information about flu, that is only aimed at one particular cohort of people. We have information about measles, that's only aimed at one particular cohort. So we think it's a bit dangerous not to go for something very general, with a strong call to action based on good national and local research and all of our behavioural science techniques that we've been using in the past, things that, you know, encourage people, that talk about the benefits to themselves, to their friends, to their families, to their communities, that make it much more ordinary, much more usual. Terms like, you know, most people are doing it. This is what you are doing to protect yourself, your family. Those sorts of things which we know from all other behavioural science will encourage people to join the crowd. We want people like them to give the messages. You hopefully have seen, I mean, they're not very like us, but there's a very nice video, national video going around with Elton John and Michael Caine, which got a national launch today. They're not very like us. And what we really want to do is more local people when we start talking about this. So local doctors, local firemen, local teachers, talking about when they start to get their vaccine. We've already done an awful lot of work with local counsellors. We're starting to use local faith leaders. So we want people to see people like them getting the vaccine and talking about it. And we also want to celebrate and thank people for doing this. You know, this is very public spirited that people are doing. We want to thank people who are helping at the vaccination centres. We want to thank the clinicians who are doing it. We want to thank the volunteers. We want to thank the community, the responders, the people who are taking time to drive people to their appointments. So we want to do an awful lot of thanking people for doing this. And then, of course, the specific and targeted campaign, which is aimed at hard to reach groups. And these are a whole range of reasons. It could be because of their lifestyle, their culture, their language, the sorts of groups who are maybe more suspicious. And as Adrian was saying, we are starting to hear quite heartbreaking bits of misinformation, which are coming from very specific groups, that we want absolutely people like them, people who they believe, to talk to them about, you know, what their concerns are, to try and reassure them, to try and give them the right information. And we want to deliver this in really easy to understand ways, and in appropriate ways. We've talked a lot about the ways that people get information. We know that, you know, some of the ways that we put out information don't get to the right people. So working through advocates, using things like local WhatsApp groups, which a lot of our communities use, using local community radio stations, various things like that. So those are the sorts of ways that we want to reach out and talk to people. So at the moment we're calling it "Say Yes to the Vaccine," but because we want to encourage as many people as possible. This may not be one of the messages that we actually use, but this is our shorthand term for what we're doing at the moment. We want to recognise where there are concerns, so we are reliant on getting a bit more data, but you know, we're picking it up and we've got anecdotal stuff. We want to provide reassurance, and we want to do that via stakeholder groups. So we want to put together things which stakeholders, people who people really believe and trust in, can take the right information out into the right arenas. We want to provide clear calls to action. So we want to talk to people about, you know, how they are absolutely helping them, helping their families, helping themselves, helping their local communities, talking about, you know, getting back to a more normal life. And we want to emphasize the benefits of doing this rather than emphasizing the concerns. We don't really want to, I mean, we are going to have to address some of the misinformation, but we don't want to go heavily on that because that just reinforces it. What we want to do is emphasize the benefits. So using case studies, using examples of people coming forward and doing the right thing and getting their vaccination and talking about it afterwards. I think that's mostly what we want to do. Already we have started to draft out some community leader toolkits. We have already started to put together a script. We've got a script which people can use now, but we've already got some community translations. We've got some videos from some key local people in communities. I've got one to show you in a minute. We're putting together some nice strong graphics. We want local stories and we want community leader endorsements. So that's where we are at the moment. And I'd be really grateful for feedback from this group about how they would like this to be developed. We'll just play you this for the end. It's not Michael Caine, but it's the nearest we've got to Michael Caine. It's Tim Alban-Jones talking a bit about vaccinations. Ooh, can you hear that?
No, there's no sound on that, Christine.
There's no sound on that. Adrian, there's no sound on that.
Okay. Interesting.
We said technology would let us down, didn't we?
How disappointing. I piloted it and everything. I tested it, I promise you, within an inch
I
of its
can send
life.
it round to all of you. It's on various people's websites. It's just a particularly nice one. I'll send it round to everybody on the board afterwards, and we'll make sure that we've got it at the top of all of our social media feeds, so anybody who's watching it will be able to see it on Peterborough or on Cambridgeshire County Council or any of the district council websites or the CCG website later on.
Appreciate that, Christine. Actually, we're all much better at lip reading now that we've got Zoom and everyone goes on mute before they actually speak.
Yes,
so.
absolutely.
I'm so sorry.
So I think, so I'll just go back to my original conversation then was, what are you expecting? What can we build in to this plan? What are your ambitions and your aspirations for this? And do you think we're along the right lines? Should we be doing something quite general as well as something targeted, or would you like us just to focus on the very targeted piece?
Okay. So I'm going to open it up. I'll just have a very quick word myself. Comment is, I don't see how you or the government can expect us to take more responsibility and action locally without being in charge of those comms as well. So to me, it makes absolute sense that the messaging should come out at the same or from the same place that the action's actually coming out. So, and as far as general or targeted or both, for me, it's both. It's as much as possible. So if you're looking for a steer from this group, I don't know. I've started off what I think, but I'll open it up to others, especially the members. Well, come on, Gary.
I'd absolutely support what we've heard, Christine, in terms of your proposals. I think it's very important we have some generalised messages. I think there's several elements that you've alluded to. First of all is people feeling that there is a lack of information. There's also a presence of disinformation, but that lack of trust in authority and those very deeply held cultural beliefs are very important to address, and that's where the more targeted piece could come. There is some initial research out now which is showing that, especially from the BAME communities, the level of vaccination is a magnitude less than in white populations. And we know the devastating impact that COVID's had on the BAME community, both in terms of hospitalisations and tragically deaths as well. So it's vitally important that we do all we can to encourage these communities to come forward. I think the bit about appropriate language, both in terms of the language, but also it being culturally sensitive as well, is vitally important. It needs to be easy to read, and people need to feel that they have a space in which they can ask questions, because and that's both prior to going for the vaccination, but also at the point of vaccination as well, which is something that I know my colleagues that are actually giving the jabs are very cognizant of. And people need to feel comfortable when they have any medical intervention and be consented, and they can only be consented if that is informed by information. So totally support what you're suggesting. I think to reach the communities that are showing a degree of vaccine hesitancy at the moment, then having people that they can relate to and most importantly trust is vitally important. I've seen some very nice videos done by GP colleagues from different communities that are circulating, and some colleagues in London that were having this issue, particularly also some staff videos and patient videos explaining why they had come forward, and they've landed very well and been very powerful in advocating for these groups. So thank you for your work you're doing, because vaccines only work if we get them into people's arms, which I know sounds flippant, but it's vitally important that people come forward for this, especially from the groups that we know are sadly most impacted should they contract the disease. Thank you.
Thanks, Gary. Thank you. Well said. Wayne, welcome. Hi.
Hiya. I've been sitting here quietly, don't worry, which is rather unusual, as most will attest to. Christine, great. Enjoyed all that. Very well thought through. It was just really another piece, and I know it's not been mentioned at all. And laugh as you see fit. Please consider using TikTok. The amount of people that I have heard that says, I'm not having the vaccine, I say, why not? Because I saw it on TikTok that actually, it does X, Y, and Z to you. And remarkably, I go, "Are you being serious?" And they go, "Yes, deadly." So just as another media, and I don't think we've ever discussed or talked about it, but messages done in such a way that there's a lot of people doing it, and they take what they see on there to be gospel, which is bizarre.
Yeah,
No,
all of our
exactly.
campaigns are on
Exactly, Wayne.
TikTok. Councillor Fitzgerald, all of our current campaigns are on TikTok.
Yeah, okay, good. So somebody's picking up stuff as being gospel. I think I have seen one that the lady first vaccinated in America, allegedly collapses and dies, which is a piece of disinformation on there. You go, how do people swallow this? I don't know.
Thanks, Wayne. Right, I've got Peter and then Bill, and we've got 4 minutes, and I'm desperately trying to finish this on time and give Christine her steer. So, Peter.
Yeah, really, really quick, because what Wayne has just covered exactly what I was going to say. Well done, Christine, as always, is great. I'm just like to say, though, it's not getting through to everybody through no fault of your own. I had to persuade quite really hard work, an elderly person in my patch to actually have their vaccination. And I ended up sort of booking it with them and giving them a lift to the vaccination centre. But they were really, really, really not happy to start with. And I managed to persuade them. So there's a lot of people who are getting this misinformation, because she obviously wasn't on TikTok, but she had been told that there's side effects and it's very dangerous. As a non-medical person, I managed to persuade her otherwise, thank goodness. But there's still some work to go, I think. And as an afterthought, I've got my jab on Friday morning.
Early Peter for a 50-year-old.
Thank you, Roger.
Bill.
Yeah, just a quick one. Just to ask Christine, have you had a good response from religious leaders, particularly in the cities, Peterborough, I expect? I mean, we can't overstate the power of the imam, the guru. So I'm just interested for a comment on that, really.
Yeah, we've currently got videos from the Muslim community in Peterborough, from the New Jewish Faith, from the cathedral, from the Hindu community, and from the Sikh community. And we think part of this toolkit we want to put together for all stakeholders and get out to all of you to have all these resources so that you are able to use them and the community leaders can use them wherever it seems sensible. And we will have materials for TikTok, because I know Councillor Fitzgerald will be having that on his site.
That's great. Thank you for that.
Okay, great. Thank you. And John, as the only elected member who hasn't spoken yet, are you this is meant to be a member-led board. Are you in favour of Christine's proposals?
I am, and I was just going to suggest to her that we look more towards the Catholics, because that's where the Eastern Europeans go. I understand that All Souls on a Sunday, it's 1,500 people in there. So, it's all right going to the cathedral and all the rest of it, but we need to get the Monsignor, or whatever they call themselves in the Catholic churches, involved. Okay.
Oh, good. Thank you, John. Thank you. Okay, I've got no more hands, and Christine, you're after a steer, and I think the steer is definitely supporting your proposals, both general and targeted, and the sooner the better, I think, was generally what was coming out there. So thank you very much for all the work that's gone into that. Thank you. And thank you, Adrian, for the presentation before. So just moving on very quickly, agenda item 7, any other business? Any members of the board who wish to raise an issue, please use the raise hand function to let me know now for the next meeting. Seeing nothing, I'm sure something will come along. Thank you very much, everyone. And at 14:59, I declare